Psychiatric assessment. Psychiatric assessment is the fundamental of a psychiatric diagnosis, treatment planning, risk management, and therapeutic alliance. Unlike many areas of medicine where the diagnosis is the primary based on laboratory finding or imaging, psychiatry relies heavily on comprehensive clinical evaluation and integration. The patient biological vulnerability, psychological function, developmental history, social environment, cultural context, trauma exposure, substance abuse, and medical conditions, fundamental impairment, and risk assessment. Psychiatric assessment is not simply conversation. It is a structural clinical investigation performing to understand the patient's symptoms, establish diagnosis, determine safety risk, and perform a evidence-based treatment plan. Psychiatric assessment use psychiatrics use a combination of a diagnosis intervention, mental status examination, psychiatric formation, risk assessment, diagnosis reasoning, and treatment plan. The goal is not only to answer what psychiatric disorders does this patient have, but also why is the patient experiencing these symptoms this point in life? What maintenance the illness and what intervention will restore function. The purpose and the goal of a psychiatric assessment is a comprehensive psychiatric evaluation and has several objectives. Number one objective is establish the primary psychiatric diagnosis. Second, to identify a comorbidity psychiatric conditions and disorders. Third is to evaluate the safety. Fourth is to develop biopsychosocial formulation. Okay. So, the purpose of establishing a primary psychiatric evaluation, the clinicians determines whether the symptoms meet the criteria for psychiatric disorders according to DSM-5 treatment diagnosis. DSM-5 diagnosis criteria, international classification of a disease criteria, evidence-based principle guidelines. Examples include the patient presentation with depression mood, may have major depression disorder, bipolar disorder, substance usage disorder, diabetic secondary to hypothyroidism, adjustment disorder, grievance-related symptoms, trauma-related depression. The assessment determines the correct diagnosis. So you have to figure that out. You have to find out between all this presentation is you have to find out which one it is. You have to rule out. Identifying the comorbidity psychiatric disorders. Psychiatric disorders frequently occur together. They occur together. For example, patients with major depression disorder may also have generalized anxiety disorder, alcohol usage disorder, PTSD, ADHD, personality pathology. Failure to identify comorbidities may result in complete treatment. You want to assess and evaluate the safety. Every psychiatric evaluation must determine the suicidal risks, homicidal risk, self-harming behavior, psychiatric-related danger, impulsiveness behavior, substance-related risks, vulnerability to exploitation. Safety assessment is not separate procedure. It is integration throughout the evaluation. Fourth, you want to develop biopsychosocial formulation. The psychiatric formation explains the predisposing factors that include factors that increases vulnerability include genetic risk, childhood trauma, neurodevelopmental abnormality, medical illness, family psychiatric history. If the patient has one of these, it is vulnerability to develop other mental illness. Precipitating factors. What are the precipitating factors? You want to evaluate the triggers. Events triggering the symptoms. What are the events that can trigger the symptoms? You want to evaluate that. Relating, those include relationship loss, job loss, medical diagnosis, trauma exposure, and substance usage. Those can trigger the mental illness, mental disorder symptoms. They precipitate. Perpetrating factors. Perpetrating factors are the factors maintaining the illness. What are the main factors that maintaining the illness? They are avoidance behavior, substance usage, poor medical compliance, social isolation, cognition disorders. Protective factors. Protective factors are those helping the patient to recover, to adapt to the situation. Those are the factors improve the outcomes. They include supportive relationships. If the patient with the mental illness or any illness have supporting relationship, that helps. improves the outcome. Employment. If the patient have an employment, that helps. Treatment engagement. If the patient engages the treatment and talk to his provider, is compliant with the treatment, report the symptoms, that helps, that factors improve the outcomes. Religion and cultural resources. If the patient have a religious and cultural resources that help him to recover. Future goals. If the patient have future goals, it improves the outcome because the person, when it reach that goal, they want to improve because of their future goals. It will be motivation factors for them. Structure of the psychiatric evaluation. So how you going to conduct the psychiatric evaluation? Comprehensive psychiatric evaluation follows the consistent structure. Components include identifying the information, chief compliant, history of medical illness, psychiatric review of the symptoms, past psychiatric history, medical history, medication history, substance usage history, family psychiatric history, developmental history, social history, trauma history, cultural assessment, mental status examination, diagnosis formation, differential diagnosis, risk assessment, and treatment plan. Second, you want to identify the information. What are the information you want to identify? You want to evaluate the beyond by establishing the evaluation beyond by establishing the name of the patient, age of the patient, gender of the patient, pronunciation. How do you like me to say your name? Relationship status, occupation. So for example, what is your name? What is your age? What is your date of birth? You want to ask the, even though you see the chart, you want to ask the patient. Relationship status. Are you married? Are you single? Do you have children? Occupational. What do you do for work? Education. What do you study? Are you going to school? Are you a student? Resources of a referral. Where do you like me to refer? Your medication, where you take the medication? Do you have a primary doctor? Reliability of the historian. So for example, patient is a 28 years, patient is a 42 years old, married woman, presenting for evaluation of a worsening depressive symptoms referred by her primary care provider. Fourth section of the evaluation is the chief complaints. Chief complaint. Chief complaint is the patient reason for seeking a care. Wherever possible, document using the person's own words. For example, I cannot get out of bed anymore. My anxiety is controlling my life. My medication are not working for me. Those are the chief compliant. Patient is complaining about them. They come to you because they are complaining about that. Chief compliant is what they are complying mostly. The chief compliant establish the patient's perspective. History of a present illness is the most important portion of the psychiatric interview. The clinicians explore the symptoms. When did this symptom begin? For example, the patient told you they have these symptoms. Anxiety is controlling my life. So when do that begin? When do the anxiety begin controlling your life? Was onset suddenly or graduate? Is this symptom come to you suddenly or graduate? Was there a trigger event? For example, patient report to you depressive symptoms began approximately 6 months ago, follow a job loss. You want to know what caused it. Duration. You want to determine if it's episodic or chronic, frequent, course over time. The questions you want to ask is this the first episode you had? Have symptoms occurred previously? Have these symptoms happened to you before? How long do the episode last? Severity. You want to know the severity. You want to assess if the severity mild, moderate, severe. Question is to ask is you want to evaluate the occupational function, social function, self-care, activity of daily living, how severe that affect all that. Functional impairment. Psychiatric diagnosis require clinical significant important. Assess the occupational function. Upstream, performance decline, job loss. You want to assess social function. Are the patients withdrawing from society? Relationship conflict. Are they in a relationship conflict? Loss of a friendship. Do they lose a friendship with these symptoms? Personality function. How is their hygiene? Is that affected their hygiene, their eating, their sleep, their medication management, their relationship, their work? You want to assess those. Then you want to assess psychiatric review of systems. Review of a systems. Systemic psychiatric review present a systemic psychiatric review prevents misdiagnosis. So you don't want to misdiagnose. Mood disorders, depression symptoms. You want to assess depressed mood. Have you felt sad, empty, or hopeless most of the days? Have you lost interest or pleasure in an activity? You want to assess the sleep. You want to assess appetite, their energy level. You want to assess concentration. You want to assess their psychomotor changes like agitation, retardation. You want to assess suicidal thoughts. You want to assist for for bipolar disorders. For bipolar disorders, you want to evaluate the patient, depression, require assessment of a bipolar disorder. You want to ask how have you ever had period when you felt usually elevated energy for several days? So you want to assist decrease of sleep, increase the confidence. You want to assist the manic episode for the bipolar disorder. That's what you are looking for. So you want to assist if they have a decrease for sleep, increase the confidence, increase the goal directed, excessive spending, because bipolar has mania and depressive episodes. So this question is for the mania. You want to assess if they have excessive spending, risk-taking behavior, hypersexuality, rapid speech, racing thoughts. For anxiety, you want to assess the generalized anxiety disorder, panic, for example, generalized anxiety disorder. You want to ask them if they have excessive worries, difficulty controlling worries, restlessness, muscle tension, fatigue, sleep disturbance. You want to assess and panic disorder. For panic disorder, you want to assess symptoms like palpitation, short of breath, chest discomfort, dizziness, fatigue, fear of dying. For OCD, you want to assess intrusive thoughts, images, urgency, compulsion. You want to ask if they are checking. If the door is closed, they always checking. You want to ask them if they are washing their hands continuously, if they are counting stuff continuously, if they reassuring, seeking all the time. That's how you assess the OCDs. For psychosis symptoms, you want to assess hallucination, delusion. You want to assess, for example, the hallucination. You want to assess what type of hallucination they are having. Auditory hallucination, visual hallucination, olfactory hallucination, tactile hallucination. What kind of hallucination do they are having? And you want to assist them, ask them and figure that out. Delusion, you want to assist them if they are having a persecution belief, grandiose, somatic belief, referential thinking, trauma assessment. Trauma assessment, you want to assess the exposure. Are they when do they expose to the trauma? Childhood abuse, violent combat, sexual trauma, accident, natural disaster. What kind of trauma they had? And you want to also assess the symptoms of the trauma that they are feeling. Are they having an intrusion symptoms like flashbacks, nightmares? Do they have avoidance that they are avoiding to remember? Negative cognition like shame, guilty, are they having those? Hypervigilant, irritability, sleep disturbance. What kind of trauma symptoms do they have? For substance usage assessment, you want to assess complete psychiatric evaluation require substance assessment. Start with alcohol usage, drug, and when you want to assess the alcohol usage, you want to assess the quantity, frequency. You want to assess the consequence of their drinking, withdrawal. Are they having a tremor, seizures, sweat? Drugs, you want to assess what kind of drugs they have been using, what type of drugs. Are they having a craving? Are they having a hallucination? Are they having symptoms? And what kind they have been using. For the past psychiatric history include previous diagnosis, hospitalization, medication history that they had, psychotherapy that they had. So for example, the past psychiatric history, you want to know the previous diagnosis that they have. For example, do they had a depression? Do they had a bipolar, psychosis, anxiety disorder, ADHD? What kind of past psychiatric history diagnosis did they have? Hospitalization. You want to assess and know date of the hospitalization for the psychiatric disorder, reason that they were hospitalized, how long had they been in the hospital, respond, and the treatment they got from the hospital. You want to also assess the medication history. For each medication, you want to know the name of the medication, dose of the medication, duration, and how long have they been taking the medication, the response that they get from the medication, side effect, if they develop any side effect or adverse effect. Reason is discontinue. Why do they discontinue the medication? Or if they are taken now, why they are having these symptoms now? And how long they've been on the medication. Psychotherapy, you want to assess what type of psychotherapy they had. Cognitive behavior therapy, dialectical behavior therapy, trauma focused therapy, family therapy. What type of psychotherapy do they have? Medical and neurological assessment, you want to assess psychiatric symptoms may result from medical conditions. So you want to assess the medical and neurological development. Endocrine, you want to review the endocrine, you want to review the thyroid disease, diabetic disease, adrenal disorders, neurological conditions. You want to assess if they had a seizure before, if they had a brain damage or brain trauma before, if they had dementia, or if they are having those now, when was the last episode they had? Medication effects. If they are having any medication that affected their mental status, like stimulant, corticoids, anticholinergics, you want to assess those. Family psychiatric history, you want to assess the depression family, if any of their family member had a depression before, bipolar disorder, schizophrenia, suicidal ideation, substance usage, all if the family has those conditions, this can affect the person. And the important question to ask is, has anyone in your family experienced similar symptoms? Has anyone died by self-harming or suicidal ideation? Social and developmental history. Social and developmental history, you want to assess the childhood, pregnancy and birth complications, developmental milestone, childhood behavior, school performance. You want to know when they were, if they born with developmental delay, if they had a ADHD, if they had, how do they develop milestone, childhood behavior, school performance. You want to also assess their education. If they have a learning difficulty, if they have a special education when they were younger or now, academic achievement, employment, you want to assess the current job they have. You want to assess the job stability. Do they just get job and quit tomorrow? Occupational function, how do they perform their job if they are able to do their job? Relationship, you want to assess the marriage, childhood, if they are married, single, if they have children, if they have a social support. Mental status examination. Mental status examination is the psychiatric equivalent of the physical examination. Mental status examination is the same as a physical examination, but this one is the psychiatric evaluation. So you want to assess the appearance. When you want to assess the appearance, you want to assess their grooming. You want to assess their hygiene, clothes, age appropriate. If they are age appropriately, behavior, you want to assess their behavior. You want to assess the eye contact. You want to assess the cooperation, if they are cooperating with you or with anyone in their social contact. Psychomotor activity, abnormal movement. Speech, you want to assess the speech. You want to assess the rate of the speech, volume of the speech, rhythm of speech, frequency of speech. For example, rapid, brusher speech may suggest a manic episode. Mood, you want to assess the mood, patient, subject, emotional state. I feel anxious. I feel worried. You want to assess that. Good. Affect. You want to assess the affect. Is to observe emotional expression. Affect is the observe emotional expression. Range of the affect, intensity of the affect, congruency of the affect, stability of the affect. You want to also assess the thought process. Assess the organization of the thought process. If the organization is the linear, logical, goal-directed, because the normal thought process is the linear, logical, goal-directed. Abnormal thought process is a loose association, fight of ideas, tangentiality. Thought block. You want to also assess the thought content. Assess the delusion, obsession. Thought content include the thought content that you want to assess include the delusion, obsession, suicidal thoughts, hallucination, homicidal thoughts. What are they thinking? Perception. Perception, you want to assess the perception. Do they have any hallucination or do they have any illusion? Hallucination and illusion are the thoughts you want to assess. Cognition. Are they oriented? Are they oriented to time, location, date? Are they oriented to the situation, or are they hallucinating and not cognition? Are they attention? Are they attention to you? Are they attentioning? Memory, how is their memory? Cognition, you want to assess orientation, attention, memory, and executive function. Can they make their own decision? Can they remember? Or that is this symptom is affecting their memory, attention, orientation, and executive function. Inside, does the patient understand their illness? The insight is, do they know what is happening? Do they understand their illness? Or they are in denial? Judgment, ability to make a safe decision. Ability to make a safe decision. Are they able to make safe decision? If they are not, their judgment is affected. Psychiatric diagnosis formation. Professional psychiatric formation integrates diagnosis, differential diagnosis, contribution factors, treatment recommendations. So, psychiatric diagnosis formation will include diagnosis. For example, person have a major depression disorder, currently recurrent, severe without psychiatric features. That's how you want to describe. Major depression disorder, recurrent, severe without psychiatric features. Differential diagnosis for that major depression disorders will be bipolar depression, substance-induced mood disorder, adjustment disorder. So what is the contributing factors for this major depression disorder? Genetic vulnerability could be the one. Trauma history could be the second. Medical factors can cause these major depression disorders. Treatment recommendations. Treatment recommendations will be the medication that you want to recommend, psychotherapy, lab monitoring, safety planning. Those include the treatment recommendations. You want to recommend the medication, you want to also recommend the psychotherapy, you want to recommend the lab monitoring, you want to recommend the safety plan. So never diagnose depression without screening for bipolar. First, screen bipolar. If there is no symptoms of bipolar, then you can diagnose depression, but never diagnose depression without screening for bipolar. Because if you prescribe depression medication and the patient has a bipolar, that can worsen the symptoms. Mental status examination is not just a checklist. It is the dynamic clinical observation. Patient often disclosure suicidal risk indirectly. Pay attention to homelessness, feeling trapped if they are saying, if they are homeless, if they are hopeless, if they say I am hopeless, feeling trapped, burden to some less, burden some less. If they are withdrawal, alcohol withdrawal, society withdrawal, sudden improvement after severe depression, those signals to risks. The best psychiatric assessment combines the structural questions with therapeutic communication. Review questions. Patient present with depression. What diagnosis must always be considered before prescribing antidepressant medication? We talked about this. Bipolar disorder. You have to consider bipolar disorder before you prescribe antipsychiatric medication. Second question, what component of a psychiatric assessment evaluation? Thought organization, thought process examination. Third question, what are the four components of a biopsychosocial formation? What are the four components of a biopsychosocial formation? They are predisposition factors, precipitating factors, perpetuating factors, and protective factors. So they are four factors. Question 4. What is the purpose of a mental health status examination? To objectively evaluate current psychological function, including logical, mood, thoughts, perception, and behavior. Advanced psychiatric assessment is a discipline clinical process require integration of the diagnosis criteria, neurological, developmental history, psychosocial factors, mental status examination, risk evaluation, and clinical reasoning. Thank you for joining me today. I would love to see you in my next video. Thank you.